Hi, my name is Katherine Kiefer, and for my project, I'm doing the topic Preventable Causes of Maternal Morbidity and Mortality. For my two countries, I'm going to be doing America and India. I chose to do America because the United States has the highest mortality and morbidity rate for women, and India also has a really high rate as well. In part one, I'm going to be researching the background and demographics of this health issue. So in this section, I'm going to research the overall issue of maternal morbidity and mortality to provide the necessary information on what we can do to prevent it in countries. This information will also consist of the history, how it affects women emotionally, physically, and socially, and why women face this. I also want to discuss the countries that have the highest mortality and morbidity rates as well as the lowest. In part two, I will be looking at the demographics of my countries. So in this section, I will research maternal morbidity and mortality in America and India. I want to look at the key factors that lead to this issue, also what things are being done now that can be prevented. For both of my countries, I will also provide information on the geography, demographics, political, educational, and economics to get a better understanding on why this is an issue in these areas. One thing I want to look at is why America has the highest rate of maternal morbidity and mortality rate when we have such advanced technology and medicine. Also, for demographics, I want to examine the age ranges in both countries to see what age we see the most maternal morbidity and mortality at. In part three, I'm going to be comparing and contrasting the issues between America and India. One thing I want to look at is the difference of lifestyle in women in these countries to see if that can play a part of this issue. I will also focus on the cultural differences, laws, belief systems, and social barriers in women. Another thing I would think would be more interesting to research is how religion plays a part in maternal morbidity and mortality. So basically, I want to see if religious people experience more maternal morbidity and mortality versus non-religious people, or is there no connection at all between religion and this issue of maternal morbidity and mortality in women? In part four, for ethical considerations and action, I'm going to be discussing what these countries' governments and organizations are doing right now in order to help the issue of maternal morbidity and mortality rates. I also want to look at if they are doing anything that makes this situation worse. I will also be discussing what further steps we can take in order to prevent the cause of maternal morbidity and mortality rates. In part five, I'm going to use this area to wrap up my presentation, showing the key points of why maternal morbidity and mortality is a problem. I will also summarize the top ways we can prevent this issue in the future.